If you've ever looked at an NCLEX question and thought, who do I help first? This lesson is going to change everything for you. Most failed NCLEX questions come down to one thing. Students don't use the safety framework correctly. ABCs, Maslow's hierarchy, and patient trends. So today, I'm going to show you the exact method that top performers use uh, to choose the right priority every time. So let's get into it. Before we dive into the ABCs and Maslow's, here's what you need to know. The NCLEX is built around safety first, meaning the sickest patients get seen first, airway outranks everything, the body's basic needs must be protected before comfort, and patterns and trends matter more than one number. So these frameworks help you answer the question, which patient will decline first if I don't intervene? That's the entire game. And once you understand those rules, NCLEX gets much easier. So let's say, okay, ABCs are always your first priority framework. A for airway, B for breathing, C for circulation. So airway, number one, always. If the airway is blocked, nothing else matters. Think choking, swelling, obstruction, unresponsive with snoring respirations. So, for example, stridor is an airway problem. A swollen tongue after ACE inhibitor is an airway problem. Post-op patients struggling to keep their air open, that's an airway problem. Okay, let's move on to B for breathing. If they have an airway but can't move air, think asthma attack, respiratory distress, pneumonia with increased work of breathing. And so signs that you'll see are increased respirations, the use of accessory muscles, shallow breathing. Okay, so let's move on to C. Once airway and breathing are stable, you're going to look for uh, bleeding, shock, low blood pressure, weak pulses, uh, abnormal perfusion. So think of ABCs like a burning building, okay? You wouldn't treat someone's sprained ankle while another person can't breathe, okay? So that's the first thing you need to know is priority. So let's look at Maslow's hierarchy. Once you confirm that there's no ABC, airway, breathing, circulation emergency is happening, Maslow's hierarchy tells you what the body needs next. So level one, physiologic needs, highest priority for ABCs. So that'll be fluids, oxygenation, nutrition, temperature, and pain, but only after the ABCs are stable. And then level two, safety and security. That would include risk for falls, confusion, newly diagnosed diabetes, a patient about to get out of bed without assistance. Okay. Now, those are your two tops. Those are the ones you're going to look at, levels 1 and 2. Now, levels 3 through 5 of Maslow's hierarchy, that's love, belonging, esteem, self-actualization. These things are almost never priority on the NCLEX. Okay. So Maslow's help when all patients seem stable. There's no ABC crisis. Two patients have similar issues. So you choose the one whose basic need is most threatened. Okay. So when you're looking at trends, a trend is a pattern over time, not just one number. This is the main thing that students have problems with. They want to look at one number and not the trend. So examples of deterioration. Blood pressure started out at 120 over 80, then it went to 100 over 68, and now it's 92 over 60. That's a falling blood pressure. Heart rate. The heart rate was 88. It went up to 102. It went up to 118. It's rising. It's a problem. Respiratory rate. It was 18, then it went to 24, then it went to 30. It's rising. That's a problem. Your SpO2, your oxygenation, it was 96%, then it went to 92%, then it went to 88%. It's falling. That's a problem. So, what does the trend tell you? The patient is getting worse, even if the number is still technically normal, but it's getting worse, okay? This is why a blood pressure of 92/60 might be more concerning than a patient with 88/40 if the 92/60 was 120/80 an hour ago. So when you look at a number, don't look at that number. Look at what the previous numbers were. Look at the trend. So think of trends like a roller coaster climbing slowly upward. You know what's coming sorry, what's coming next. A drop. Vital signs do the same thing. The pattern tells you what's about to happen. Okay. So let's break this down into an NCLEX scenario. Okay, using all three frameworks. Yeah. Okay, so you have four patients. Who do you see first? You got a post-op day 1 abdominal surgery with respirations of 28, shallow breathing using accessory muscles. Your second patient, a COPD patient reporting severe pain, 8 out of 10, requesting more medication. 3, you have a client with diabetes, blood glucose 300 milligrams per deciliter. They're alert and asking for breakfast. Then number 4, you have an elderly patient who's confused and climbing out of bed. So let's walk through this. Step 1, look at the ABCs. Patient 1, breathing issue, leading priority. Okay. Number 2, pain is not first unless it impacts your airway, breathing, and circulation. Patient 3, no airway, breathing, or circulation issue. And number 4 is a safety issue, but not at the airway, breathing, circulation level. Okay. Now you look at step 2, Maslow's. Patient 4, safety need. Patient 3, physiologic, glucose, but not emergent. And 2, the patient, your patient, patient number 2, comfort, physiologic, but stable. Okay, they're hurting, but they're stable. So when you look at trends, patient 1 is showing worsening breathing, effort, and deterioration is likely. Okay, so the correct order is number 1, you would see patient 1 first, breathing. They're in some kind of respiratory distress. That's your ABCs. Then you're going to see patient 4 because they're a safety, they're a fall risk. Then you're going to see patient 3. The glucose is 300, but it's non-emergent. And then the last person you're going to see is patient 2. Yes, they're in pain and they need pain control, but it's not emergent. Okay. Okay. So now let's do a mini challenge. Okay. It's your turn. So you're going to have 4 clients that you have to see. You have a patient who has pneumonia with an oxygen saturation of 90% on 2 liters nasal cannula. You have a client reporting chest pain, 7 out of 10, stable vital signs. You have a client with hypoglycemia, blood glucose 55 milligrams per deciliter. They're alert and shaky. And then you have a post-op hip replacement patient. They're confused, trying to pull out their IVs. Okay, so who would you see first? All right, so your first patient would be patient number 1. They have an airway, breathing, and circulation problem. Okay, so breathing. SpO2 is 90%, means hypoxia. They may decline fast. Airway, breathing outranks everything. The second patient you'll see is patient 2, the chest pain patient. Could be cardiac. That's why you're going to see them next. They need a rapid assessment. But breathing, the patient with the breathing problem is more unstable. That's why you'll see them before the chest pain. The third patient is the hypoglycemia patient. They're alert, but they need food fast. Physiologically, they're stable because they're asking, they're probably asking for food, so that they're good enough to be third. And the fourth patient is your confusion patient. They're a safety concern. They're not emergent. The hypoxia and the chest pain is more important than the safety issue. So let's try to put this all together. Now, now that safety frameworks, the safety frameworks, I'm sorry, that went on NCLEX. Always look at ABCs, your Maslow's hierarchy, and your patient trends. These three rules guide every prioritization question. When you use them correctly, NCLEX stop feeling like you're guessing all the time. It starts feeling like it's logic. You're understanding why you're making the decisions that you're making. Okay. So make sure you download the clinical judgment and prioritization workbook at NurseEdScholar.com. I built it so you can practice these scenarios with step-by-step rationales. Don't forget to like this video, subscribe, and hit that notification bell so you don't miss lesson 3. We're going to be talking about recognizing deterioration early. You got this. I'm cheering for you. I want you to succeed. Hey, we need nurses, so please continue studying, please continue learning, and please keep, being, thinking like a nurse and being that nurse that you've always wanted to be.